Welcome to our deep dive on Barrett's esophagus. Today we'll be exploring this condition that can develop from persistent acid reflux.
Yeah.
Kind of a long-term consequence of heartburn.
Right.
We've got some really interesting information from medical articles and a patient education site created by a gastroenterologist
Okay.
to help us kind of break it all down.
Sounds good.
The surprising thing is, we all know what heartburn feels like, but did you know it can actually lead to changes in the cells lining your esophagus?
Absolutely.
Almost like if someone tried to repave a street with the wrong kind of material.
Yeah.
It just doesn't hold up the same way.
That's a great analogy. You see, long-term exposure to stomach acid can really damage the lining of your esophagus.
Yeah.
When your body tries to heal that damage, it can sometimes replace the normal cells with cells that are more like what you'd find in your intestines.
Oh, wow.
This replacement is called intestinal metaplasia, and that's the telltale sign of Barrett's esophagus.
So let's break down why stomach acid is so tough on the esophagus. We all know that feeling of heartburn.
Right.
But why is stomach acid so harsh?
Well, your stomach uses a powerful acid, hydrochloric acid, to break down food.
Oh, wow.
It's strong enough to dissolve meat. That's how you digest that tough steak you had for dinner.
So our stomachs are like little acid factories.
Haha. Kinda.
Why doesn't it hurt our own stomachs?
That's a great question. The lining of your stomach is specially designed to handle all that acid.
Okay.
It has a protective layer that prevents the acid from digesting the stomach itself, but your esophagus doesn't have that same kind of healed.
So how does the esophagus normally avoid getting burned by stomach acid?
That's where the lower esophageal sphincter comes in, the LES.
LES.
Yeah, it acts like a one-way valve at the bottom of your esophagus. It lets food pass down into your stomach,
Okay.
but keeps the acid from splashing back up.
So if that valve isn't working properly, stomach acid can sneak back up into the esophagus and cause problems.
Right.
That's acid reflux, or GERD, right?
Exactly. And if that reflux happens frequently, over a long time,
Yeah.
it can lead to those cellular changes we talked about, the intestinal metaplasia. That's the hallmark of Barrett's esophagus.
Okay, so how do doctors figure out if someone has Barrett's esophagus?
The gold standard for diagnosing Barrett's esophagus is an upper endoscopy.
An upper endoscopy. What does that involve?
It might sound intimidating, but it's really not that bad. The doctor uses a thin, flexible tube with a camera on the end to look at the lining of your esophagus. And you're under anesthesia, so you won't feel a thing.
So they can actually see if there are any changes in the lining.
Exactly. And during the endoscopy, they can also take tiny samples of tissue
Okay.
called biopsies. These biopsies are sent to a lab where they can be examined under a microscope
Yeah.
to confirm if those intestinal cells are present, giving us a definite diagnosis.
Okay, so let's say someone is diagnosed with Barrett's esophagus. What does that actually mean for them?
It's important to understand that Barrett's esophagus itself isn't cancer, but it does increase the risk of developing a type of esophageal cancer called adenocarcinoma.
So it's not cancer,
Right.
but it increases the risk.
Yeah, not everyone with Barrett's will develop cancer.
Hmm.
It's essential to monitor the condition
Right.
because the risk is definitely higher.
Okay. How much higher is the risk for someone with Barrett's esophagus?
The risk of developing esophageal cancer in people with Barrett's esophagus is estimated to be about 30 times higher
30 times.
than in the general population.
Wow, that's definitely a significant increase. So what happens next? How do doctors manage Barrett's esophagus?
Well, it depends on whether there are any precancerous changes in the cells,
Oh, okay.
which we call dysplasia.
Dysplasia.
There are 2 stages, low grade and high grade. Think of it like a staircase with 6 steps.
Cool.
Each step represents a level of severity, with the top step being cancer.
Okay.
Our goal is to prevent patients from ever reaching the top step.
I like that analogy. So how is Barrett's esophagus managed if there is no dysplasia?
If there's no dysplasia, the focus is on controlling the acid reflux that's causing damage.
Okay.
We want to prevent any further changes.
So how do you stop the acid from splashing back up into the esophagus?
There are a few approaches, including lifestyle changes and medications.
Okay, let's start with the lifestyle changes.
Sure.
What are some things people can do to manage their reflux?
There are some simple things that can make a big difference, like sleeping with your head elevated.
Okay.
Also, avoiding large meals late at night, managing your weight, and staying away from foods that trigger your heartburn.
And what about medications? What types of medications are used to control acid reflux?
There are 3 main types: antacids, H2 blockers, and proton pump inhibitors, PPIs.
PPIs.
Antacids work by neutralizing the acid that's already in your stomach.
Oh, okay.
They provide quick relief, which is great for occasional heartburn, but they're not a long-term solution. So more like a quick fix.
What about H2 blockers? How do they work?
H2 blockers work a little differently. They block a specific type of receptor in the stomach
Okay.
that's involved in acid production.
Okay.
This means they actually prevent acid from being produced in the first place.
Interesting. So they're more preventative.
Exactly.
Yeah.
They are more effective than antacids, but they don't last as long as PPIs. PPIs are the most powerful medications for controlling acid reflux.
Okay, so PPIs are the heavy hitters.
You could say that.
Tell me more about how they work.
PPIs work at a cellular level by blocking an enzyme in the stomach that's responsible for producing stomach acid.
Wow.
They dramatically reduce the amount of acid the stomach makes,
Oh.
making them ideal for treating GERD and managing Barrett's esophagus.
Since PPIs seem to be so effective,
Mm.
are there any specific types that are commonly prescribed for Barrett's?
Yes, some common ones include omeprazole, Piliosec, esomeprazole, Nexium, lansoprazole, Prevacid, and pantoprazole, Protonix.
Okay.
All of these are available over the counter except for pantoprazole, which needs a prescription.
And how are they usually taken?
Timing is important with PPIs. Unlike antacids and H2 blockers, they are best taken about 30 minutes before the first meal of the day.
So you take it on an empty stomach and then wait a bit before eating.
That's right. You want to give the medication time to be absorbed before your stomach starts producing acid in response to food.
Okay, that makes sense.
Yeah.
I want to touch on something we discussed earlier, the safety of PPIs.
Okay,
There has been a lot of talk about potential risks associated with taking them long term.
that's true.
Yeah.
There have been some concerns raised about PPIs, but it's important to look at those concerns in context. One of the most thorough studies to date on the potential downsides of PPIs,
Okay.
known as the COMPASS trial,
The COMPASS trial.
didn't find a link between those medications and a wide range of potential issues.
That's reassuring. Can you tell us a bit more about the COMPASS trial and what it looked at?
It was a massive study involving over 17,000 patients, and it followed them for an average of 3 years.
Wow.
They specifically looked at the long-term safety of PPIs
Okay.
and investigated a wide range of potential side effects like fractures, dementia,
Right.
chronic kidney disease,
Mhm.
and various types of cancer.
And what did they find?
The results were pretty clear. PPI use was not associated with any of those conditions.
Wow.
Study authors emphasized that for patients with conditions like Barrett's esophagus, the benefits of PPIs likely outweigh the risks.
So based on this large study, long-term PPI use is generally safe.
Yes.
And the benefits for managing Barrett's esophagus often outweigh the risks.
Absolutely. But as always, it's crucial to talk to your doctor about any concerns you have about your medications.
This is all good news for people with Barrett's esophagus who rely on PPIs to manage their condition.
It certainly is. It's
yeah.
important for patients to feel confident in their medications, and the COMPASS trial helps provide that reassurance. But like with any medication, it's important to discuss any concerns you have with your doctor.
So we've talked about managing Barrett's esophagus without dysplasia. What happens when dysplasia is present? How does the management approach change?
When dysplasia is present, it means there are precancerous cells in the lining of the esophagus.
Okay.
So in this case, we take a more proactive approach.
Okay.
The goal is to remove or destroy those abnormal cells
Got it.
and prevent them from progressing to cancer.
So the stakes are higher when dysplasia is involved.
Yeah.
What kind of treatments are used in those cases?
There are several options, and the choice depends on the grade of dysplasia. For low-grade dysplasia, which is an early stage, regular monitoring is key.
Okay.
We might recommend a procedure called endoscopic resection,
Endoscopic resection.
which removes the damaged cells. Another option is radiofrequency ablation, which uses heat to destroy those abnormal cells.
And what about high-grade dysplasia, which is a more advanced stage?
For high-grade dysplasia, the treatment is more aggressive
Okay.
because the risk of cancer is higher.
Right.
In addition to endoscopic resection and radiofrequency ablation, we might consider cryotherapy,
Cryotherapy.
which freezes and destroys those abnormal cells. In some cases, surgery might be necessary to remove a portion of the esophagus.
It sounds like managing Barrett's esophagus with dysplasia can be quite involved.
It can be, but the good news is there are effective treatments available. With early detection and proper management, most people with Barrett's esophagus can live healthy, fulfilling lives.
That's good to hear.
Yeah.
What about follow-up care? Once someone has been treated for Barrett's esophagus,
Hmm.
what kind of monitoring is needed?
Regular follow-up is crucial.
Okay.
No matter the stage of Barrett's esophagus or the treatment used,
Okay.
even after treatment, there's a chance that Barrett's esophagus could come back.
Really?
Ongoing monitoring helps us catch any changes early.
What does that monitoring usually look like?
It typically involves periodic upper endoscopies with biopsies to check for any signs of recurrence or progression. How often you need these endoscopies will depend on your individual case.
So lifelong monitoring is likely necessary for most people with Barrett's esophagus.
That's correct. It's important to follow your doctor's recommendations and keep those follow-up appointments. Early detection is key when it comes to managing this condition effectively. Now, there's also some really interesting new technology that's changing the way we assess risk in Barrett's esophagus. It's called TissueCypher.
I was just about to ask about that. I've heard about TissueCypher. Can you tell us a bit more about it?
Absolutely. TissueCypher is a fascinating new tool that uses artificial intelligence to predict the risk of developing high-grade dysplasia or cancer in patients with Barrett's esophagus.
AI and gastroenterology.
Right.
That sounds pretty cutting edge.
It is. You see, we've traditionally relied on dysplasia grading to assess cancer risk, but that method can be subjective.
Okay.
It doesn't always give us the complete picture.
Right.
TissueCypher offers a more precise and personalized approach.
So how does TissueCypher work?
TissueCypher analyzes biopsies taken during an upper endoscopy, but it digs a little deeper than traditional methods.
Okay.
It looks for specific protein biomarkers within the tissue to understand a patient's risk of developing high-grade dysplasia or cancer. TissueCypher examines these biomarkers
Yeah.
and their patterns within the tissue to give us a more detailed risk assessment.
So it's not just looking at whether dysplasia is present or absent. It's actually going a step further.
Yes.
What kind of information does TissueCypher give you?
It gives us a risk score from 0 to 10,
Okay.
which shows the likelihood of a patient progressing to high-grade dysplasia or esophageal cancer within the next 5 years.
Okay.
The higher the score, the greater the risk.
Got it.
It also helps categorize patients into different risk groups: low, intermediate, and high. This helps tailor monitoring and treatment recommendations.
It sounds incredibly valuable to have that level of personalized information.
And you know what's really fascinating about TissueCypher? It's like having a powerful microscope that allows us to see the cellular landscape of the esophagus in incredible detail.
I love that analogy. So we're not just looking at cells under a regular microscope.
No, it's much more advanced than that. TissueCypher uses a special technique called spatialomics,
Spatialomics.
which means it analyzes how those key biomarkers are arranged within the tissue sample.
So it's not just about the presence or absence of those biomarkers, but also about their location,
Yeah.
how they relate to each other.
Exactly. Think of it like a city map. You don't just want to know that there are houses and stores. You want to know where they're located in relation to each other.
That makes perfect sense.
Yeah.
So the spatial arrangement of these biomarkers can give doctors important clues
Mm-hmm.
about the risk of cancer developing.
Precisely. Once we have these detailed images from the biopsy,
Right.
they are analyzed by sophisticated artificial intelligence algorithms.
Okay.
These algorithms can process huge amounts of data and identify patterns that would be impossible for a human to see.
Wow, so the AI is doing the heavy lifting, sifting through all that data
Right.
to find the important clues.
That's right. Based on this analysis, TissueCypher generates that risk score we talked about,
Okay.
giving us a much more precise and personalized assessment of each patient's risk.
That level of personalization sounds amazing. Now let's shift gears and talk about some of the things people can do to manage acid reflux and potentially reduce their risk of developing Barrett's esophagus in the first place. We touched on lifestyle changes earlier, but can we delve into those a bit more?
Absolutely. Lifestyle modifications play a crucial role in managing acid reflux and potentially reducing the risk of developing Barrett's esophagus. While they may not completely eliminate the risk, they can significantly improve symptoms and overall well-being.
That's good to know. So what are some of the key lifestyle changes people can make?
One of the most effective changes is elevating the head of your bed. You can do this by placing blocks under the head of your bed frame
Oh,
or using a wedge pillow. This helps prevent stomach acid from backing up into the esophagus while you sleep.
that's a simple but effective tip. What other changes can people make?
Avoiding late-night meals is another important step. When you eat close to bedtime, your stomach is still working hard to digest food while you're trying to sleep. This can increase the likelihood of acid reflux. It's best to finish dinner at least 2 to 3 hours before you lie down.
That makes sense. Are there any specific foods that people should avoid?
There are some common trigger foods that can worsen acid reflux symptoms.
Okay.
These include fatty and fried foods, chocolate, caffeine, alcohol, citrus fruits, and spicy foods. However, trigger foods can vary from person to person, so it's essential to pay attention to your body and identify any specific foods that seem to worsen your symptoms. Keeping a food diary can be helpful for this.
So it's about being mindful of what you eat and how it affects your body.
Exactly. And in addition to dietary changes, maintaining a healthy weight can also make a difference.
Okay.
Excess weight puts pressure on the abdomen, which can push stomach acid up into the esophagus.
Right.
Losing even a small amount of weight can help alleviate reflux symptoms.
What about smoking? I know that's bad for overall health.
Right.
But does it specifically impact acid reflux?
Yes, smoking can definitely worsen acid reflux.
Really?
Nicotine relaxes the lower esophageal sphincter,
Oh, wow.
making it easier for acid to back up into the esophagus. Quitting smoking is one of the best things you can do for your overall health, including your digestive health.
That's great advice.
Mm-hmm.
We've covered a lot of information today, but I want to emphasize one key takeaway. While Barrett's esophagus is a serious condition, early detection and management can dramatically improve outcomes.
I couldn't agree more. If you have any concerns about your digestive health, please don't hesitate to reach out to your doctor. They are your best advocate and can guide you through the process of getting diagnosed and creating a personalized treatment plan.
That's such an important message. Knowledge is power, and taking charge of your health can make all the difference.
Absolutely.
Thanks for joining us on this deep dive into Barrett's esophagus. We hope you feel empowered and well-informed. Until next time, take care.